Good afternoon. Thank you for joining us today. I am Assistant City Manager Steve Vieira. I'm presenting on behalf of Mayor Paulette Guajardo, who cannot be at today's COVID briefing. I'd like to start off by thanking our City County Health Department as well as our Corpus Christi Fire Department, who helped get the COVID vaccine out to those who want and need it. I'd like to start off by touching on some of our vaccination numbers. As of today, the Public Health District has administered 150,000 vaccinations. That's 7,000 more than this time last week. Nueces County has 162,948 fully vaccinated individuals. We urge each of you to get vaccinated because we've seen the immense decrease in COVID numbers when our community practices safe protocols against this virus. I want to remind everyone to the messages that we've stated since the early part of this pandemic. 1, wash your hands and wash them often. 2, wear a mask. And 3, practice social distancing. Having the extra protection of getting the vaccine will only help you and those you're around every single day. If you're still looking to get vaccinated and would like to, there are several options available. If you are 12 years of age or older and looking to get vaccinated today or as soon as possible, you can go to La Palmera Mall. The Public Health District has been working very hard to provide this vaccine to you. La Palmera Mall is averaging 400 daily vaccinations. You can find the clinic at the old Charming Charlie's location right across from Grimaldi's Pizzeria. The vaccine clinic is open every day, Monday through Saturday from 10 a.m. to 9 p.m. and Sunday from 11 a.m. to 6 p.m. If you are immunocompromised, you may also go to La Palmera Mall to receive that additional dose. The City County Health District has also opened the Greenwood Senior Center as another open vaccine site. The Greenwood Senior Center is open Monday through Friday from 12 noon to 7 p.m. and Saturday from 10 a.m. to 5 p.m. This vaccine site was made available for those that need another location, which is easier to get to when most people are getting out of work. If you need to get a ride to get your vaccine, the Corpus Christi Regional Transportation Authority will provide rides to and from the City Vaccination Clinic at La Palmera Mall. Once on a bus, just tell the driver that you're going to get the vaccine. And to make vaccines as convenient as possible, Mayor Paulette Guajardo initiated the in-home vaccination program back on August 12th. Our Corpus Christi Fire Department is working double time to provide those vaccines to you. They are providing first, second, and additional doses to those who need it. To date, our fire department has registered over 900 residents and administered over 300 vaccines. If you would like an in-home vaccination, please call the city's customer service center at 826-CITY. That's 826-2489. The mayor has also relaunched our Save Our Seniors program and are providing additional doses to our senior citizens in the community. We have contacted over 3,000 senior citizens to inform them of the opportunity to receive their third shot, and to date, our Corpus Christi Fire Department is working on 488 senior citizens who will be receiving their additional dose. If you're a senior or know of a senior in need of an additional shot, again, please call the city at 826-CITY, 826-2489. Mayor Guajardo has also initiated another program that will make getting the vaccination more convenient to people in our school system. So this is really exciting for us. The Teen Mobile Vaccination Program, also known as Teen MVP, kicked off today at Atkins Middle School. Tonight, the Public Health Department will be at Veterans High School for a vaccine site that is open for all students aged 12 and older that have parent consent forms. This site is also for teachers, school staff, and parents. Throughout the month of September, every Wednesday and Thursday, the Public Health Department will be at different middle and high schools to accommodate those who are still looking to get their vaccine shots. Again, the goal is to make this vaccine easily accessible to you. You can find more information on this particular program at www.cctexas.com/teenmvp. It's important to know that you can still get COVID tested for free on Monday through Thursdays at the Old Memorial Hospital parking lot from 9 a.m. to 2 p.m. It's a drive-through testing site. Also, if you've tested positive for COVID or are experiencing mild symptoms, you can still receive the Eureka Cove Rapid Infusion at Physicians West Plaza, located at 2601 Hospital Boulevard. This infusion is referral only and takes place Monday through Friday from 8 a.m. to 5 p.m., Saturdays from 8 a.m. to 1 p.m. Many local providers and health department hotline representatives are also referring people with mild symptoms and COVID-positive tests to the State Rapid Infusion Center at the Richard M. Borchard Fairgrounds on Tuesdays and Thursdays. Lastly, for any information regarding vaccinations, please go to www.cctexas.com regarding any of these programs or to get registered to get the vaccine. I urge everyone to protect yourself, your family, and friends by getting vaccinated. We can only achieve success in fighting the virus with your help, and we need to focus on that one specific goal, and that's wear a mask and get vaccinated. Thank you. We'll now turn it over to Gabby for a Spanish translation, and then we'll have Nueces County Judge Barbara Canales up next.
A la fecha, el Distrito de Salud Pública ha administrado 150,000 vacunas. El condado de Nueces tiene 162,948 personas completamente vacunadas. Seguimos instando en que se vacune si aún no lo ha hecho. Contamos con muchas opciones disponibles. Para mayores de 12 años puede ir al Centro Comercial La Palmera en la antigua tienda Charming Charlie's. El horario de atención es de lunes a sábado de 10 de la mañana a 9 de la noche y los domingos de 11 a 6. Si su sistema inmune es débil, también puede ir al mall para recibir una dosis adicional en el mismo lugar. Otra opción es el Centro para Adultos Mayores Greenwood, abierto de lunes a viernes de 12 del mediodía a 7 de la noche y el sábado de 10 de la mañana a 5 de la tarde. Si necesita transporte para recibir su vacuna, los autobuses del RTA lo pueden llevar al Centro Comercial La Palmera de manera gratuita. Solo dígale al conductor que va hacia allá y no le va a cobrar. En cuanto a las vacunas en el hogar, el Departamento de Bomberos está proporcionando la primera y segunda dosis, así como las dosis adicionales a quienes lo necesiten. Hasta la fecha, el Departamento de Bomberos ha registrado a más de 900 residentes y ha administrado más de 300 vacunas. Si desea una vacuna en el hogar, llama al Centro de Atención Telefónica al Cliente de la ciudad al 826 City, o sea, 826-2489. Para el programa Salvando a los Adultos Mayores, los bomberos están proporcionando terceras dosis a las personas que se encuentran confinados en sus hogares. Si sabe de un adulto mayor que necesita una vacuna adicional, llame al 826-2489. La alcaldesa también lanzó otro programa llamado Programa de Vacunación Móvil para Adolescentes. Este dio comienzo el día de hoy en la Escuela Secundaria Atkins. Esta noche, el Departamento de Salud Pública estará en la preparatoria Veterans Memorial para poder vacunar a estudiantes de 12 años en adelante, que tengan formularios de consentimiento de sus padres. Este sitio también es para maestros, personal escolar y padres de familia. Durante todo el mes de septiembre, todos los miércoles y jueves, el Departamento de Salud Pública estará en una escuela intermedia y secundaria diferente para ayudar a quienes quieran vacunarse. Puede encontrar más información en el portal www.cctexas.com/TeenMVP. Para quienes quieren saber si cuentan con el virus, las pruebas de detección continúan realizándose de lunes a viernes en el antiguo Hospital Memorial, ubicado en el 2626 de Hospital Boulevard, de 9 de la mañana a 2 de la tarde. Si ha dado positivo en la prueba de COVID y está experimentando síntomas leves, posiblemente califique para una infusión rápida Regen-Cov en el mismo lugar. Esta infusión solo se realiza a petición de un médico. Se realiza de lunes a viernes de 8 de la mañana a 5 de la tarde y los sábados de 8 a 1. Las infusiones también se llevan a cabo en el Centro de Exposiciones Richard Borchard en Robestown los martes y jueves. Para obtener información sobre las vacunas, visite www.cctexas.com para saber más sobre estos programas y para registrarse para recibir la vacuna.
Gracias, Gaby. Barbara Canales, Nueces County Judge. I have 5 topics that I think are important to cover today, and so let's go over them briefly. County Services Update. I want to let you know where we are at the county with our workforce situation and some of our departments. I want to talk about the hospitalization rate because I think that's something every Wednesday we need to understand where we are with our hospitals because that tells us everything we need to know about how this community is faring with COVID-19. I also want to talk about additional resources that are coming soon and additional resources that we need. Let's talk also this afternoon about the state of Texas providing mobile infusion service for the homebound. You've heard a lot about the programs that were just articulated. I'll tell you what we are, is we're program rich around here. If you want to get a vaccine, there is a program for you. I mean, we've got more programs than, clearly we have, arms. I mean, we've got to get away from creating new ideas and getting people to just do what they need to do to protect this community. I mean, I'm tired of slogans and jingles because it isn't necessary. You just need to say, it can save your life. I want to talk about the booster shots that are coming, and I want to talk about something that I'm really worried about. It's something that, quite frankly, anybody that works hard, I'd like to think I'm one of those folks, they look forward to each and every year. That's Labor Day weekend. That's because that's a time for us to thank the people that are out there in the workforce, from small business to middle-sized businesses to large industry. And I want to tell you why I'm worried about Labor Day weekend this year. So last week, we talked about updating you with regards to county services. And in particular, I announced that our motor vehicle registration office at the county courthouse, which is, I have to say, one of the most popular offices for folks coming to visit the county courthouse, it was closed due to an outbreak of COVID-19, which impacted a number of our employees. I don't know if I mentioned this, but it wound up being multiple offices for the tax assessor. Our Bishop office was also closed. This office remains closed, both at the courthouse and in Bishop. And this week, I have issued an order under my Section 418.08 emergency powers recommending that all Nueces County department heads and elected officials evaluate their departments and determine which of the employees could execute their job functions remotely, away from the office setting. I want to make sure that there is clarity here. That does not mean that I am ordering everybody to work remotely. Quite the contrary. I'm asking all electeds and department heads to evaluate their offices so we can protect and preserve their workforce. If they believe that they have a reason to send some of their workforce home for remote work, chances are it's because COVID-19 has impacted their office. They will have the discretion to direct those employees that, again, can execute their job functions remotely to do so. Fortunately, because of last year, we have made so many improvements to our systems, our workflows, and our policies that it makes it very possible for our employees to work remotely and our residents to conduct their business using online, email, regular mail, and any retail service options that are presented to them. It also allows our workforce to do exactly their same job with strong productivity because of virtual opportunities that were made available by the county last year. However, we do know that some people are looking to come to the courthouse to transact business, and that is only available to conduct in person. And we recognize that not all residents have access to online services. We promise to restore in-service and in-person services at the courthouse as soon as it's possible. And what does that mean? It means as soon as it's safe to do so. Now on to our hospitalization rate. So here is a little bit of good news to report. Our hospitalization rates peaked last week at 39.09%. Do you remember last Wednesday I was here with the charts and the graphics that showed 37%, and that was quite alarming. However, that number has come down. Yesterday's rate was just over 34%, and we hope this number will continue to decline. Now, I need to put this in perspective for you. You can take any statistic, any time, and make it look good, or you can make it maybe look negative. In this case, it's just the facts, ma'am. 39% was last week, 34% is this week. Make no mistake about it. 34% means we have a highly stressed hospital system. 34% is terrible, but it's better than 39%. And I want that number to keep coming way down. Remember, COVID patients require a lot of care, monitoring, respiratory therapists, and they require more isolation to prevent infection from spreading. Their providers have to wear a certain amount of PPE, even for becoming infected themselves. It's a completely different type of staffing when we talk about patients with COVID-19. This is important because we're always talking about this hospitalization stress, and I want everyone to understand what is stressful about it. Patient for patient, COVID patients place a greater than average burden on our hospitals. So, what are we doing about it? Let's talk about the state resources for those hospitals. Fortunately, we are gaining resources that we need, and this is coming from the state of Texas. So here's a moment of gratitude, and I hope I express it on behalf of all Nueces County residents, that they have responded, they being the state of Texas, has responded to our STAR request for people, equipment, and supplies, and from our community, where nurses and healthcare professionals have responded to our calls to serve, and we are grateful. And some were retired, some were semi-retired, some had lost their jobs as their employers went out of business due to COVID. There's so many different reasons people come back into the workforce, but no matter what it is, whether they are contractors from out of state or folks that have come out of retirement or have come out into a new workforce environment, the bottom line is I come to express my gratitude. I'm grateful. I'm grateful to the Texas Division of Emergency Management, to DSHS, the Department of State and Health Services, for all the aid that they have sent and they will be sending in the future. And I'm grateful for our neighbors and our colleagues who have answered this call to serve. I think it's important to note that just today we had a very strong meeting with Congressman Cloud, who helped facilitate our 3 CEOs of the hospitals, and members of our disaster recovery management specialists who understand FEMA and the ability that they bring to us to pay for continued staff. It is my goal, it is the desire of Nueces County to keep the staff we have. It is going to be absolutely critical that we don't expire their contracts on September 30th when there is a call to share costs. I want that signal to be met loud and clear. We will absolutely do everything in our possibility to keep that staff and continue to grow that staff number. Why? Because it means more beds online. Now let's transition to mobile infusion. There's a lot of talk about Regeneron, and there are lots of ways, just like there's lots of ways to get vaccinated. We have our rapid injection center at 2601 Hospital Boulevard, and they take walk-ins there, and they will get you medically qualified with an order, a doctor's order there. We also have the Rapid Infusion Center at the Richard Borchard Fairgrounds run by the state of Texas. And now we have a new asset that we announced just a few days ago. It is a resource that also comes from the great Lone Star State, and they're sending it to us. It's called the Mobile Infusion Team. And just like that SOS program, this comes to you in your home. The Mobile Infusion Team can bring the monoclonal antibodies directly to those who are in need but cannot travel. This is a really terrific service because obviously it's available to our seniors that are homebound, those who have physical mobility issues, those who lack transportation, and those who just cannot travel due to whatever medical condition that they might have. This team is not, replacing or in lieu of, it's in addition to the team which is already providing those therapies that I mentioned at the fairgrounds and the one at our COVID community clinic at 2601 Hospital Boulevard. Now, there is a number for this infusion team to come mobile to your house, and it works through a call center. So in order for providers, that means doctors or patients or anybody just needing general information about this in-home infusion, here's your number. It's 1-800-742-5990. And information is available in English and in Spanish on that number. So please call it. So I know Gabby's going to translate it, but that important number is 1-800-742-5990. 1-800-742-5990 para las infusiones móviles de los anticuerpos del tratamiento Regeneron. Puedes hablar ese número 1-800-742-5990. Information, as I said, is available to you, I believe, I need to make sure it's 24/7, but let's just say definitely during working hours. But Annette's shaking her head that I think that infusion center is available 24/7. So let's talk a little bit about those monoclonal antibodies. And I know I go over this again, but you have to be an ideal candidate for it, right? So you can't be in the hospital. And there is ideal candidates everywhere that test positive for COVID-19 if they have very mild or moderate symptoms. And these are the antibodies that can help the body fight the disease and in many cases lessen the severity and shorten the duration of the illness. And while I do not have exact causation or proof that that rate went from 39% to 34%, let me tell you what I do know. That the work that we're doing with Regeneron in this community is making an impact. And I don't think it's coincidence that we had good vaccination numbers, right? 7,000 more. We had awesome Regeneron numbers. And that is what is making the difference in these hospitalization rates. And it means that we are in control. It means we can make a difference in our own destiny. So again, this is good for patients. It helps them from being admitted to the hospital. And isn't that good for all of us? So it's one more tool in our toolbox to fight COVID. And as I said, we're already seeing the benefits, particular to the most vulnerable. And I want you to look and listen when Annette comes up and talks to you about the statistics of who died today. Because there were a lot of people, and they were all unvaccinated. So I don't want to belabor the vaccination point, but it's important to know that those increasing numbers that were given to you earlier, we're seeing the majority of those coming from all these clinics around town, and so that is so important. And again, because there's so much misinformation out there, please know that the vaccines protect against this Delta variant, which seems to infect younger people more than ever. And it affects them in a way that the original coronavirus was not. In fact, I was with Dr. Peterson earlier today, and she told me something that I did not know, and that there seems to be a nexus between juvenile diabetes, and they're seeing so much diabetes associated with COVID-19. This is not good either. So this is a great reason to get informed and get your children vaccinated if they qualify in that 12 and up category. Look, we're going to be delivering booster shots soon. And again, when we get those available to us on September 20th, we're going to bring you all the latest and greatest information. I want to end with Labor Day. Again, I look forward to holidays. I think everybody does, particularly when you're stressed or you're tired and you've really been at something for a long time. Don't we all make special plans? We think of them as ways to connect with the family and our friends, and quite frankly, it's what we do best in America, I think, that we celebrate one another. And the CDC has asked that the unvaccinated not travel this weekend. That's a big statement. And I want to make sure that everybody hears it. They're asking that the unvaccinated not travel this weekend. The CDC has also advised that while people who are fully vaccinated can travel, to take precautions, because these transmission rates mean they too can take COVID-19 risk, that they should take it into consideration in their activities. So, nationwide, the hospitalization rate is 16 times greater in the unvaccinated population than those vaccinated. And when we travel, it does put people in situations where they're more likely to become infected because group activities and hotels and going out to eat and all those things, can put you at risk. If you already have plans, just do the things that you know make sense. Wearing the mask, washing your hands, doing all the things that you really need to do in order to protect yourself. I would ask you to consider the CDC's guidance and just be safe. That's all. Just please be safe. And that's all the usual ways that you already know. I think that it's important to say that there's going to be a lot of ways to celebrate, and we want everyone to live long and happy lives. And I think being able to get out on Labor Day is going to be good for our mental wellness, But I definitely think that we don't want to have anybody come back and say, I had this great time, and then find out that they have COVID. So I want everyone to have a safe and enjoyable Labor Day weekend, but I know what happens every single holiday. You know, I told you guys it's like watching that movie again and knowing the results. Unless we are committed to one another, this community, these are hospitals that protect us every single day. Labor Day will be no different than July 4th or Memorial Day. It means 2 weeks from Labor Day, we will see another surge, unless we decide to do something about it. I hope that we can all find a way to come together and remember that we're trying to preserve our holidays for generations to come. I thank you, and as always, stand ready for your questions. Don't forget, jump on noisisknows.com for up-to-date information, and for our latest campaign, take a look at some of the videos that we've been posting online and on our noisisknows.com website. They come from real individuals who've lost loved ones to COVID-19, and they come from the heart. Thank you.
La semana pasada anuncié que la oficina de registro de vehículos motorizados en la Casa de Corte estaba cerrada debido a un brote de COVID que afectó a varios empleados. Esta oficina permanece cerrada. Hemos realizado muchas mejoras en nuestros sistemas, nuestros flujos de trabajo y nuestras políticas que hacen posible que nuestros empleados trabajen de forma remota. Sin embargo, sabemos que algunas personas tienen negocios que deben realizarse en persona y reconocemos que no todos los residentes tienen acceso a nuestros servicios en línea. Restauraremos el servicio en persona tan pronto como sea seguro hacerlo. Tenemos algunas buenas noticias que informar. Nuestras tasas de hospitalización alcanzaron su punto máximo la semana pasada con más del 39% y parecen estar en declive. La tasa de ayer fue un poco más del 34% y esperamos que este número continúe disminuyendo. En cuanto a los recursos estatales, afortunadamente estamos obteniendo los recursos que necesitamos de parte del Estado de Texas, que ha respondido a nuestras solicitudes, equipos y suministros, y de nuestra comunidad, donde enfermeras y profesionales de la salud han respondido a nuestras llamadas de servicio. En cuanto al servicio de infusión móvil, uno de los recursos que nos ha enviado el Estado de Texas es un equipo de infusión móvil. Este equipo de infusión puede llevar los anticuerpos monoclonales directamente a quienes lo necesitan, pero no pueden viajar. Este es un gran servicio disponible para nuestros adultos mayores y aquellos con problemas de movilidad física, aquellos que carecen de transporte y aquellos que no pueden viajar debido a otras condiciones médicas. Este equipo se suma al equipo que proporciona terapia con anticuerpos monoclonales en el Centro de Exposiciones Richard Borchardt en Robstown. Para más información sobre esta terapia puede llamar al 1-800-742-5990. La información está disponible en inglés y en español en ese número. Esta terapia es solo para aquellas personas que califican y cuentan con una receta médica. En cuanto a las vacunas, hemos visto un número de aumento de personas que se están vacunando en el Centro Comercial La Palmera. Siga instando a sus amigos y familiares quienes aún no lo han hecho. Las vacunas protegen contra la variante Delta, que parece ser capaz de infectar a las personas más jóvenes de una manera que no lo hizo el coronavirus original. Recientemente se han visto más casos de jóvenes afectados con el virus y una relación con la diabetes. Así que es importante que los jóvenes mayores de 12 años se protejan vacunándose. Pronto estaremos autorizados a administrar las vacunas de refuerzo. Una vez que tengamos esa información, se la daremos a conocer. En cuanto al fin de semana del Día del Trabajo, los Centros de Control de Enfermedades están pidiendo que si aún no se ha vacunado, evite viajar. Y las personas vacunadas que vayan a viajar tomen sus precauciones. Haga lo posible por aminorar la propagación del virus. Espero que tenga un feliz Día del Trabajo y tome todas sus precauciones. El Día del Trabajo no es diferente a cualquier otro día feriado. Esperamos que las cifras no continúen en aumento.
Thank you, Gabby. Annette Rodriguez, Health Director. I'm going to start with the Nueces County COVID-19 statistics. And if you look at this first slide, you're going to see 2 weeks worth of COVID cases. And if you look all the way to your left at the 590, that first week totals 3,375 people positive for COVID-19 last week. This week, we've had 2,474 people positive with COVID-19 in just 1 week. I guess, if you look at silver linings, the number has gone down finally, so that is some good news. If you look at today's numbers, 495 COVID positives today in Nueces County. Almost 200 of those 495 cases were children 18 years of age and younger. Next slide. So this donut diagram gives us total number of COVID cases in Nueces County. So if you added all the numbers together on this diagram, you'd get a total of 59,658 COVID cases in Nueces County, almost to 60,000 cases since March of 2020. So 51,943 have recovered. But the concerning part is always the active cases. These are individuals that are still within that time period that they can transmit the virus. And there is a total of almost 7,000 active cases currently in Nueces County. Next slide. These are the hospitalizations here in Nueces County, and these include not just Nueces County residents, but others from outside Nueces County that utilize the hospitals. If you look at last week, we had, you see the steep rise in hospitalizations. We had a total of almost 3,000 hospitalizations last week if you look at the hospitalizations by day. The peak being at 444 people hospitalized in Nueces County hospitals, and that's within the 3 healthcare systems. So it's not just one particular hospital, it's all of them. And then you see for this last week, you see that the numbers are starting to kind of come down, kind of plateau. The total were 2,875 people hospitalized this past week due to COVID-19. Next slide. These are the ICU patients. These are people, of course, that are more critical and needing more care, like the judge mentioned. We had last week 673 people in the ICU with COVID-19, and this week the numbers have actually gone up to 764. So remember, first you get infections, then you get hospitalizations, then people move into the ICU, and then you see fatalities after that. Next slide. The total number of COVID-19 deaths in Nueces County has surpassed 1,000. We're at 1,023 as of today. If you look at leading causes of death, if you had categorized it, the top leading causes of death are normally heart disease, cancer, cerebral vascular accidents. If we were categorizing COVID-19, which we will, it just hasn't been put in statistically, it would be the 3rd leading cause of death in Nueces County for 2020, and we believe for 2021 it may be the 2nd or the 1st leading cause of death in Nueces County. And the last slide that you see here are the fatalities, and so you see the last 2 weeks, and you can see that last week the numbers were a little higher. We had 13, we had 15 on one day. Last week the total fatalities were 55 fatalities in 1 week. People died due to COVID-related situations, and then this current week we've had 46 people that have died due to COVID-19 or COVID-19 related problems. The last 3 days in August, the 29th through the 31st, there were 16 deaths due to COVID, 13 were unvaccinated. I'm going to talk a little bit about what the health department's been doing. So August, Delta variant-driven COVID-19 surge made it one of the worst months of the entire pandemic. We saw record-breaking numbers, 11,945 COVID cases, the most ever in 1 month, ever since the beginning of this pandemic. 15 deaths on August the 25th, the most ever in a single day. 60 deaths in 1 week, and 6 times the number of deaths that we had had the previous month, totaling 154 deaths for the month. CCISD surpassed 1,000 COVID cases, ranking it 5th in the state of most reported cases in just 16 days since opening school. Our community needs your help. Our healthcare workers and first responders are tirelessly working to keep you safe, but they cannot do this alone. Please get vaccinated. We know the Delta variant is far more devastating for every age group, including children. Currently, 99% of all COVID cases in Texas are due to the Delta variant. Doctors nationwide are reporting an alarming trend of school-age children getting sick with the virus and requiring hospitalizations. Today, our hospitalizations rate went up also to 14 in Driscoll Children's Hospital. We are seeing more young patients now than at any other time during the entire pandemic. Of those 14 children that we have hospitalized, 2 are in the ICU on ventilators. This may be partly because no COVID-19 vaccine has been authorized for people under age 12 and the widespread circulation in the United States of the Delta variant. Almost half, 46.4% of the children hospitalized with COVID-19 between March of 2020 and June of 2021 had no known underlying conditions, according to the CDC data from almost 100 U.S. counties. In most cases, COVID-19 may be milder in young children than in adults, but parents and caretakers should understand that children can be infected with the coronavirus and they can develop complications requiring hospitalizations and that they can die. The CDC and the American College of OBGYNs, after considering the risks versus the benefits, recommend that pregnant and lactating individuals receive a COVID-19 vaccine or vaccine series. OBGYN and other women's health care practitioners should lead by example by being vaccinated and encouraging eligible patients to be vaccinated as well. It has never been more urgent to increase vaccinations as we face this highly transmissible Delta variant and see severe outcomes from COVID-19 among unvaccinated pregnant women. The community also saw the unfortunate passing of 2 unborn babies this month from COVID-19, the first in our community. Everybody wants to move forward. Nobody wants to have to wear masks forever, but we're not going to be able to stop this pandemic until we have a significant percentage of the population vaccinated. We are currently only barely at 53%. Our children deserve to have full-time, in-person, safe learning with prevention measures in place. On Monday, August the 30th, just this past Monday, we opened our second vaccination clinic located at the Greenwood Senior Center, and it's Monday through Friday, 12 to 7 p.m. to try to get anybody that works after hours, they can come in. On Saturdays from 10 to 5. You can get first or second doses of the mRNA, Pfizer, or Moderna. We will soon have J&J available again. It was no longer being made there for a while, but it's back, and so we're going to be able to order from the state here very soon. Also, you're still able to go to La Palmera Mall and get your vaccines there 7 days a week during mall hours. We are still providing Regeneron, which is a monoclonal antibody, like the judge mentioned. It's treatment for mild to moderate illness. Once you've been hospitalized, we cannot give referrals for monoclonals. It's too late at that point. This treatment is 70% effective at avoiding hospitalizations and death. The first location for the monoclonals is at the Physicians West building, which is across from the Old Memorial Hospital, 2601 Hospital Boulevard, and is open from 8 to 4, Monday through Friday, and Saturdays from 8 to noon. The second location is at the Richard Borchard Fairgrounds in Robstown, and it's open 7 days a week from 7 a.m. to 7 p.m. And they do take some walk-ins, but you have to call the health district first to get that referral process going, because they only allow us so many walk-ins and only at certain hours of the day. So referrals are required. Please call the health department at 361-561-1414 1101. Thank you. This Monday, September 6th, we will have reduced hours from 8 to noon due to Labor Day. Testing is also being conducted at the Old Memorial Hospital. The hours are Monday through Thursday from 9 a.m. to 2 p.m. Except this Monday, there will not be testing to give the staff a chance to be able to get some rest and spend some time with their families as well. Finally, get vaccinated. Wear a mask. Especially protect your children, especially during this Labor Day weekend. I do have the last 3 slides that I want you to look at. There's one right there. I think it's a really important slide. If you look at the right side, those are vaccinated individuals on the right side. And you see a little sliver of green people along the bottom. That makes up 549 fully vaccinated individuals that did end up getting COVID positive, but with mild to moderate symptoms for the most part. But if you look at the left side of that slide, all of those red people, that makes up 13,429 people that were not vaccinated from the period between July 1st and September 1st here in Nueces County. I think this slide says it all. If you're unvaccinated, please think about getting vaccinated. Once you make that decision, go in and get vaccinated as soon as possible. Next slide. This shows the same thing. This is for hospitalizations here in Nueces County. And if you look at the right side, these are vaccinated people that had to go to the hospital, and you see 18 of those individuals. But on the left side, you see 125 people in 1 week in one of our hospitals here in Nueces County, 125 people not vaccinated who were hospitalized. And then for the final slide, I would just like to take a moment for the 1,023 citizens that have passed away due to COVID-19. Prayers are powerful for a nation in crisis. I'd like to take a moment of silence to remember these 1,000 plus individuals that have died of COVID-19, and then we can turn the translation over to Gabby. Thank you.
$3,375 casos positivos se reportaron la semana pasada, 495 casos el día de hoy. Desde que se comenzó a tener las cifras en cuanto a los casos positivos desde el mes de marzo del 2020, han sido 59,658 los casos en el condado de Nueces. Actualmente son 1,023 personas las personas que han fallecido debido al coronavirus. 6,692 casos activos se encuentran actualmente. 395 personas se encuentran en el hospital, 111 de ellas en la unidad de cuidados intensivos. El día de hoy se reportan 6 fallecimientos. El aumento del COVID-19 debido a la variante Delta durante agosto lo convirtió en uno de los peores meses de toda la pandemia. Vemos cifras récord, 11,945 casos de COVID, la mayor cantidad, en un mes. 15 muertes se reportaron el 25 de agosto, la mayor cantidad en un solo día. 60 muertes en una semana y 6 veces el número de muertes que tuvimos el mes anterior, totalizando 154 muertes por mes. CCISD superó más de 1,000 casos por COVID, ubicándose en el 5º lugar en todo el estado. Actualmente, el 99% de todos los casos de COVID-19 en Texas se deben a la variante Delta. El día de hoy tenemos 14 niños hospitalizados y 2 de ellos se encuentran en la unidad de cuidados intensivos ayudados con respiración artificial. Esto se debe en parte a que aún no existe una vacuna para menores de 12 años. Mientras que para las mujeres embarazadas, después de considerar los riesgos, los CDC y el Colegio Americano de Obstetras y Ginecólogos recomiendan que las mujeres embarazadas y lactantes reciban una vacuna contra el COVID o una serie de vacunas. Nuestra comunidad también vio el desafortunado fallecimiento de 2 bebés aún no nacidos este mes debido al COVID. El lunes 30 de agosto abrimos nuestra segunda clínica de vacunación ubicada en el centro Greenwood. El horario es de lunes a viernes de 12 del mediodía a las 7 de la noche, los sábados de 10 a 5 de la tarde. La primera y segunda dosis de Moderna y Pfizer están disponibles. Próximamente también Janssen. Las vacunas también están disponibles en el centro comercial La Palmera los 7 días de la semana durante el horario normal del centro comercial. Seguimos proporcionando Regeneron, que es un tratamiento con anticuerpos monoclonales para enfermedades leves a moderadas. Este tratamiento tiene una efectividad del 70% para evitar hospitalizaciones y fallecimientos. La primera ubicación es en Physicians West Building, en el 2601 de Hospital Boulevard, frente al antiguo Hospital Memorial. El horario es de lunes a viernes de 8 a 4 y los sábados de 8 a 12. La segunda ubicación es en el Centro de Exposiciones Richard Borchardt, en la ciudad de Robstown. Para poder obtener este tratamiento se requiere de una referencia médica. Si usted no cuenta con un médico o necesita una referencia médica, puede llamar al 561-1101. Este día lunes 6 de septiembre tendremos horario reducido de 8 a 12 durante el día del trabajo. Las pruebas estarán cerradas para el día lunes debido al día de trabajo y se van a reanudar el día martes. Le pedimos proteger a los menores vacunándose, ya que aún no se cuenta con vacunas para menores de 12 años. Y una gran mayoría de las personas que se encuentran hospitalizados o que han estado hospitalizados no contaban con una vacuna.
All right, good evening, everybody. My name is Dr. Chris Bird. I'm here to speak to you on behalf of the Texas A&M University Corpus Christi Informatics and Modeling team. Next slide, please. That's good. We have two objectives on the task force, or on the modeling team. The first is to address your concerns and questions about COVID-19, and the second is to help enable evidence-based decision-making on behalf of our local leaders. Next slide. And today I found myself wondering why I need to present when the judge and the public health director did such an excellent job of it. But then I remembered, well, I present statistics for the whole coastal bend and not just Nueces County, and I also provide projections that you haven't seen yet. I want to start with talking about some of the coastal bend records that we've unfortunately hit in this Delta wave. The first is 3,683, and that's the number of people that tested positive for COVID-19. This is a confirmed positive test in a 1-week period of time that happened on August 23rd, 2021, in the previous 7 days. And it was about 27% higher than any previous number that we had seen in 2020 during the first real big peak that we had. Next. Point 2 will come up. The other number is 556. That's the total number of inpatients that were in Coastal Bend hospitals that had COVID-19. It's the highest we've ever seen. It was on August 29th, just a couple days ago. 2021, the previous high was 528. So this Delta wave is in some ways the biggest COVID wave that we've had yet. Next slide. Okay, so let's look at the numbers broken down by age class across the coastal bend and by who's been vaccinated and who hasn't been vaccinated. First off, on the left-hand side, you see the large peaks and dots. Those are the people that have not been vaccinated. The majority of people that are testing positive have not been vaccinated. And unfortunately, the age group that is testing positive the most are 0 to 19-year-olds. And then it just goes, as you get older and older, there's fewer and fewer people testing positive through to the 60 plus at the bottom there. On the right side, you can see the people that are vaccinated with either 1 or 2 doses that are testing positive. It's a very small number of people, even though in Nueces County, 53% of people, I believe I heard, are fully vaccinated. Next slide. And you also heard Judge Canales talk about this number, 34%. That's the amount of capacity in our hospitals that's dedicated to treating COVID patients right now, 34%. It's the highest number in the state. It is indeed slightly lower than it was at the peak, but it's still much, much higher than the 15% threshold that 6 months ago would have triggered businesses rolling back capacity and would have triggered a lot of other interventions to take place. So this is a very high number, and what it means, the fact that this number is higher here than any other place in the state, it means that our hospital workers, our healthcare professionals, are working harder than anybody else in the state to fight COVID-19. And it hasn't been just today, this has been happening for weeks now. Remember that our doctors and nurses are working hard to try to help us get healthy, and they're at an unprecedented load of COVID-19 relative to other parts of the state. Next slide. The hospital vacancy is at the lowest point, and I don't mean today, but in this Delta wave, and within the last week, it's been in the lowest point that it's ever been during the COVID pandemic. Today, it's at 7.7%. That's the amount of staffed beds that don't have anybody in them. And you can see that it's much, much lower than at any other point than in the past. Before August, pretty much, this number was well above 30%. Next slide. Okay, now we're going to get into the projections and where we sit. We are at the peak or just past the peak of people with COVID-19 in the ICU. As long as we keep up our vigilance to try to stop the transmission or slow down the transmission of COVID-19, the projection right now with the model was that it peaked on August 29th. We'll see how well that projection holds. With the holiday weekend coming up, it's possible that the projection will change. The projection is assuming that we're going to do the same thing this weekend that we did last weekend. And sometimes a weekend doesn't make that big of a difference, but look at where we're at there. We're right at the peak. That means there's a lot of COVID out there in the community. That means that a lot of people could potentially contract COVID if they make themselves vulnerable to it this weekend. So just remember that. We want everybody to have fun and enjoy their holiday weekend, and we don't want anybody to get COVID or worse, end up in the ICU. Next slide. The total number of inpatients peaked within the past week. Go back one slide. There we go. Total number of inpatients peaked within the last week. Got a phone call there. I was hoping that wouldn't happen. And it is going down. So hopefully this trend will continue. Hospitalizations follow positive cases. The positive number of cases is going down. So hopefully the number of people in the hospital continues to go down here. Next slide. With the fatalities, we're not at the peak yet. Now, the model projects that the peak is going to be tomorrow in terms of fatalities, but of all the projections we're making here today, this is the one that I'm the least certain about because of the complex dynamics of who's been vaccinated and who hasn't, in which age classes, and how likely they are to face mortality due to COVID-19. If anything, this is a very optimistic projection. I don't foresee it being any less or earlier than this. It may be a little higher and later. We'll just have to see. Next slide. Okay, and this is just the number of cases, and it shows you how the model is fit to the number of cases. This is not the cleanest plot, but when we look at these number of cases over week time periods, it's a very, very clean plot. This is what the model looks like, and we are indeed heading downwards. If we continue with the same level of vigilance now that we had in place last week, this trend will continue down. Now, for the surfers out there, and I know there's some of you, you know that it's not just about the height of the wave, it's about how thick the wave is. That's where all the power is. Now, if we keep our vigilance up, we're going to keep the wave thin, and it won't have a lot of power. But if our vigilance wanes and we kind of let off the masking and some of the other things, the vaccinations and things like that, then that wave can get thicker than what it looks like there. And that's not what we want to happen. We want a less powerful wave that's narrow and thin, not a thick wave. Okay, next slide. Some doctors have asked me to plug the monoclonal antibody sites. They're free. And this is a map of Corpus Christi. It's not easy to see here in the room. Hopefully it's easier to see on your screens at home. But there's two spots where you can get them. One is Physicians West. One is the Borchard Fairgrounds, in town or out of town. And again, if you want to show up and walk in, make sure you call the public health department first to initiate that process. And you want to do this right after you test positive, not after you end up in the hospital, because you can't do this anymore then. The monoclonal antibodies, they decrease your probability of ending up in the hospital. So that's why you're encouraged to do that. So last slide, and we're going to click through these point by point, get the first point up there. The new cases have peaked and we're headed down, so that's good. Next point. The hospitalizations have peaked or are peaking, depending upon whether you're looking at the total number of inpatients or the ICU. The ICU is peaking right now. That happens a little later. And the fatalities are still rising, but the model projects that tomorrow should be the peak. I'm saying I think it's going to be a little later than tomorrow, being the one who makes the projections, but it shouldn't be too far into the future. Next point. So what can we do here to flatten this curve and make sure that the rest of this wave doesn't become a very powerful, thick wave like a surfer would look for? We're not looking for a good surfing wave with COVID. We're looking for a very poor wave. And so if you're symptomatic, self-isolate, number 1. 2, get tested. 3, if you test positive, get the monoclonal antibodies. Okay? 4, try not to get yourself in a situation where you're needing to get tested in the first place. Masks work. They're super cheap. You put it on, it works immediately. That's why I have it above getting vaccinated right now, because you can help just by putting on that mask. After you put on that mask, make sure you continue social distancing. What I found of all the things that we have to do to control COVID, social distancing seems to be one of the ones that people don't have any problems with. At the store, even people that aren't wearing masks, I'm noticing they kind of, don't want to be real close to the next person in line, so that's good. And lastly, after you put on your masks and your social distance, get vaccinated if you haven't yet. That's going to stop the next wave. It will help to prevent this wave from stretching out longer than it has to. And it works. Of everything that, of all the treatments that are out there, the most powerful tool long-term against COVID is getting vaccinated. It is better than all the other treatments that you may have heard about. It has more support. Why would you want a treatment that only a fringe number of people think might work when here's the one that everybody agrees works? That's a qualified healthcare professional. So with that, we'll go to the final slide. Thank you. We'll have the translation, and then Public Health Director Rodriguez will come up and answer any questions that you might have.
Hemos rebasado cifras récord en una sola semana, en la semana del 23 de agosto, 3.683 casos tan solo en una semana. La cifra mayor anterior fue el 16 de julio del 2020 con 2.917 casos. También el número de hospitalizaciones ha llegado a cifras récord. La gran mayoría de las personas hospitalizadas no cuentan con la vacuna. El 34% de las hospitalizaciones en el condado es por casos de coronavirus. Las camas disponibles en los hospitales es del 7%, el punto más bajo que se ha reportado. Creemos que actualmente nos encontramos viendo las cifras pico de casos por coronavirus, pero ahora con el día feriado, esas cifras pudieran aumentar, especialmente si usted no toma las precauciones. En cuanto a fallecimientos, creemos que aún no hemos llegado al momento pico. Si continuamos tomando las precauciones que hemos recomendado desde el principio, podremos controlar el aumento de esos casos, especialmente durante el fin de semana feriado. En cuanto a los tratamientos monoclonales, estos van a disminuir sus posibilidades de ser internado en el hospital, pero ese tratamiento debe de tomarse lo más pronto posible una vez que haya sido diagnosticado con el virus. Recuerde que usted necesita una receta o referencia médica. Para obtener una, si no cuenta con un médico general, puede llamar al 561-1101. Recuerde, tome todas sus precauciones y evite la propagación del contagio del virus.
Thank you, Gabby. Thank you all for being here. There are no questions today, so thank you, and we will be back next week. Thank you. Stay safe.